Universal beginning steps.
Okay, so you're gonna go in, introduce yourself. Mr. Smith, we need to get an IV. The doctor's ordered some IV fluids for you, so we need to start an IV to get these IV fluids going, and an IV antibiotic as well.
Check for allergies.
Okay, so we'll double check their chart, check their armband. Are you allergic to anything, Mr. Smith?
Calculate IV infusion rate.
Okay, so I get my doctor's orders, have an order to infuse normal saline at 100 mils an hour. So I've got my normal saline, and I'm gonna check this fluid. Let's go into that as well.
Select IV fluid and check for expiration date, cloudiness, etc.
Okay. More than likely, what you have in your bag may not be expired, but anything in the lab, it's usually donated equipment, so it's probably gonna be expired. But get in the practice of doing that, check my IV. It is expired, but it's okay to use on my plastic hand. So this is okay, and I have my tubing as well, and I've verified on the doctor's orders that this is the correct solution, and I'm gonna set my pump at 100 milliliters an hour.
Prime tubing and hang on IV pole.
Okay, so I'm gonna open this up. Open up your tubing. Sometimes it may have a lot of papers wrapped around it, so just get it to stretch out completely. First thing I'm going to do, what I'm always going to do no matter where I get the IV tubing from, I'm going to clamp it off. It's going to be the first thing I'm going to do. Okay? I'm going to leave all the caps on, everything else unclamped. I'm just going to use the roller clamp to clamp it off. Am I still on the
Prime and hang on the pole.
Prime and hang on the pole. Okay. So in different bags, we'll have different ways to remove them. So just be aware that not every one may look alike. Not any two facilities. Depending on what's the most economical IV bag they purchase, that's what's going to determine how the cap comes off of it. So that's going to pop off. This has got to remain sterile. This has got to remain sterile. So the most important thing is for me not to touch them with my hands or touch them to anything besides directly into that bag. So this tip is going to go directly into this bag. You're just going to use a twisting motion to get it all the way in there. Okay. All right. Got it in there far enough. I'm going to hang it on the pole. And I'm going to squeeze the drip chamber. Usually you'll see a little line on the drip chamber, and you'll want to fill it up to that line. Okay? So there. And then you can have a garbage can. Usually you don't even have to take the tip off the first time that you prime it. It'll usually run without it. If you encounter any problems with getting the fluid to run, then you may have to loosen or remove the end clamp. But right now, usually we'll run without it, so we'll try that, okay? So you run it all the way down, and you just watch it run through, and you see there it's making a mess on the floor. That's where your garbage can comes in handy, and you clamp it back off as soon as you have it fully primed all the way to the end, okay? So you'll have a garbage can to prevent that mess on the floor, and then you'll clamp it back off. You have your tubing completely ready. You can loosen that a little bit so that it will be easy to get the cap off. But there again, this is a sterile tip. We don't want to just take the cap off and lay this around anywhere. We want to keep that covered up, okay? So I'm just going to lay it right here where I'm going to need it to hook up to my IV.
Select appropriate venous access device.
Okay? So the appropriate venous access device is going to be determined by your client. If it's a very healthy young individual, then you can maybe pick a 18 or 20 gauge needle. If it's an older, more frail client, a 22 gauge would probably be more appropriate. Typically, you want to try to get an 18 to 20 in most all clients, if it's possible, for blood transfusion purposes, okay? But I have a 22 gauge, and those are better to use, smaller gauge. to protect our hands, okay?
Prepare equipment at bedside. Must verbalize that if using an INT or extension set, you would prime the saline.
Okay, so I do not have that, and I don't know if y'all have that in your kit, but there is a short extension set that will connect directly to the IV. And what it does is it allows you from having to break down the IV all the way up to the hub, and it gives you a little extension with a blue cap on the end of it that you can connect your IV fluid directly to that, okay? So I don't have an extension, but anytime you ever use an extension, it always has to be primed with normal saline, because it would have air in it, and we don't want to inject any air into our clients.
Locate a peripheral vein and correct patient.
Okay? Get my tourniquet. I'm gonna look for pull tight there and just loop it right under. Okay? Alright. Got a couple of good ones here. I'm gonna try to go with this one right here. Okay?
Cleanse area using a circular motion with antiseptic swab.
And I'm gonna detach the tourniquet while I cleanse. Okay? Okay?
Don gloves. Place tourniquet 4 to 6 inches above selected site.
Okay. Kind of limited on here. You can verbalize how far above the site that you would put it, okay? That's probably about 4 inches right there.
Feel for pulse below the tourniquet site.
Okay, so I'll be sure I hadn't cut off their blood supply. I can still feel a pulse there in the radial area.
Insert the sterile IV needle / angio cap.
Okay. And yours may look different than this, but the same equipment. You'll notice that there is a tiny little plastic catheter plastic sheath that's actually covering the needle there, okay? So I just want to be sure and check that that is going to be able to be loosened, that it's not stuck to the needle in any way, okay? And I'm going to pull the skin taut again, so pull the skin tight, and then maybe at a 15-degree angle, inject into the vein, and then usually as you get into the vein, you can kind of drop the needle down a little bit more. And there again, we may get some flashback, we may not. But at the point that you get some flashback, what you're going to do is advance. As soon as you get flashback, go just a hair more, and then you're going to advance the sheath, the plastic sheath off the end of the needle. You're going to advance it into the client, okay? And you're going to have a safety feature on the needle that engaged, okay? And then I'm going to, most of the time it's going to have blood pouring out of it, but attach the primary tubing directly to that.
Release the tourniquet,
Okay?
leaving stylet and catheter. Place digital pressure over distal end of catheter and carefully remove stylet. Connect ordered IV fluids after connecting INT or extension set if appropriate. Secure with tape and apply sterile transparent dressing.
Okay. So we've got a dressing that's going to be in your little dressing that's in your little kit. Okay. And we just want to be sure that we put this where we can see the insertion site. Okay. So we'll briefly put that on there.
Regulate infusion according to
Okay.
medical order. Verbalize how to set the IV infusion pump as well, and how to manually regulate IV rate.
Okay, so if it's 100 milliliters an hour, I would have to do the calculation to figure out exactly how many drips a minute that would be. I would have to count the drips. And then if I was setting it on a pump, I would attach it to the pump and set the pump at 100 milliliters an hour. Okay?
All right, we're moving to the intravenous piggyback.
Yes.
Check the MAR against the medical order for the patient's name, type of medication, dose, time, date of order, allergies, and route.
Okay? So you'll have your MAR with your doctor's order and verify all of that information.
Verify the compatibility of medications and fluids being mixed.
So if they had another antibiotic hanging, even if they have plain normal saline, I want to go to my drug book and double check that this ampicillin 500 milligrams that's ordered is safe to give with whatever other IV fluid, what other IV medications they may be getting. They may be on a continuous infusion of Pepsid or something else, and they may be getting another IV antibiotic simultaneously that's requiring that they only have one access, and so we're having to give both at the same time if they are compatible. So you go to your drug book and you check for compatibility. Okay?
Obtain the correct medication from pharmacy or medication cart.
Okay?
Must verbalize classification of med, the safe dose, and safe rate of infusion, incompatibilities, side effects, nursing actions, and patient teaching.
Okay, so I got my amoxicillin or 500 milligrams. It's an antibiotic. I have checked and verified that there are no compatibility issues with the other medications that are hanging. I would make my patient aware of side effects, nausea, vomiting, diarrhea, any other particular side effects for that medication, as well as if they were a female client, you would want to make them aware of the antibiotics affecting contraceptives too. Okay?
Calculate correct infusion rate for IVPB.
Okay, and so you have a small bag that is designed for IV piggyback. So whatever medication dosage that you have, there's only going to be one volume because you have one bag. Okay, so the volume is going to be the bag you have. This is a 50 milliliter bag, and I'm pretty sure you have a 50 milliliter bag in your bag for your IV piggyback. So you can practice your calculation problems. The dosage, the actual amoxicillin 500 milligrams is kind of a side note because you're concentrating on the volume that you have the bag in. That's what you're going to have to base your numbers off of. But if there's any reconstitution or anything, that could factor into it if you add more volume to it. But this is going to be the volume of your bag, so don't forget that, okay? You're not going to have a volume on your order because you're putting it in this volume of a bag, okay?
Attach tubing spike to solution using sterile technique.
Okay. And this is an older tubing. These aren't going to match up perfectly, but I'll try to explain that. Hook that we'll use, and roll the papers off. See, this one has a little different end on it. It's this blue port, and a lot of times it'll tell you med, but you can tell that that's an injectable port, so you know that's not the one you're going to pull off. This one right here is going to be the one I'm going to pull off. There again, I'm going to keep that sterile on the inside. This sterile and to the IV tubing, okay? I didn't clamp it off, so before I flip it over, if you do flip it over before clamping it off, that's when you're going to have a big problem with a whole bunch of bubbles in there, okay? So I'm going to hang that there.
Prime IV piggyback tubing. Hang the solution on the IV pole.
Okay. Go.
Lower primary IV bag with extension hook if applicable.
Okay. So this has to be lower than the one we're infusing. Okay. Gravity is going to help us out here. So this needs to be lower, and that's higher. Okay.
Check to see that existing IV is functioning properly.
Okay, so I need to double check This fluid has been infusing with no problems, but I don't see any redness, swelling, and I don't see any leaking around this IV site. So if it's not in use with another primary, I'm going to get a 10 ml syringe and I'm going to test to be sure that this IV is working right before I attach any medication to it.
Clean the injection port on primary line with an antiseptic swab and connect tubing.
Okay, so I'm going to clean the port. Usually you want to find one of the ones closest to the client and that the bag can reach as well. So I'm going to clean that port, okay? And I'm going to get my tubing here. What you're going to have at the facilities most consistently is going to be a lure lock, just like it's going to screw onto that IV. This is going to screw directly onto there. This is actually a puncture, this is not a needleless system, whereas all of the other things will be. This has the little device in it. But most everything you're going to have is going to screw on directly like this. Your tubing is going to screw on directly like that. But this right here, we don't have that. But this is the way that I would hook that one up. So you can kind of see how that would be.
For compatible medications, open the IV piggyback slide clamp.
Okay.
Administer correct dose, if correct, of correct IV piggyback antibiotic medication to the correct patient at the correct rate, maintaining sterility. After completion of IV piggyback, close slide clamp and raise primary solution to previous level, if applicable.
Okay. And when you are calculating your IV drop factor, you're going to look at your watch and say it's going to be 30 drops in 60 minutes and in 60 seconds. So that's going to make it 15 drops in 30 seconds. That's going to make it about 7.5 drops in 15 seconds, right? So you could count, like, if you see it hitting between 7 and 8 at that 15-second mark, you should be right at the 15 drops per second. The 15 drops per minute at the 30-second mark to make a total of 30 at the minute mark. Am I making sense? I'm not confusing you, am I? But if you take what you've got, divide it by 2, you get what you need for 30 seconds, and then at 15 seconds. Because if you wait and count those 30 drops at the minute mark every time, you may spend 5 minutes there trying to get regulated. So it makes it much simpler for you to break it down to that 30 seconds or 15 seconds so that you can calculate it quickly. You see what I'm saying? So if you get it to 7 or 8 drops at 15 seconds, you should have it at the 15 drops by 30 seconds, and you should be on track at the 1 minute mark. Okay? So we got that regulated, we got that done, and I have put my primary fluid back in the position it needs to be in.
Regulate primary line according to medical order.
Okay, so I need to put it back to where, because you're probably going to have to open it wide open in order to get that to flow. So I'm going to put it back where it needs to be, okay?
Dispose of used equipment. Must verbalize that a secondary line may be left for the next dose according to hospital policy, but sterility of the connection must be maintained. And universal ending steps.
Okay, so we're going to put them in the lowest position, get them comfortable, and we're going to come right back and get prepared to discontinue the IV.
Universal beginning steps.
Okay, it's time to discontinue the IV, Mr. Smith. The doctor said that you've gotten enough fluid. I think they're planning on sending you on home, so we need to go ahead and get your IV out.
Turned off intravenous fluid flow with regulator clamp. Put on your gloves.
Okay.
Untape the intravenous needle and remove dressing. Withdrew the needle or angiocath.
Right there. Hold pressure.
Apply pressure to the puncture site with alcohol prep or cotton ball.
I'm gonna double check that the whole tip is intact as soon as I pull it out, and everything looks intact.
Observe needle and or angiocath for intactness or frayed edges. Observe punctured area for signs and symptoms of inflammation, infection, or bleeding. Apply a Band-Aid to puncture site. Hospital policy may require antibiotic ointment. Observed amount and type of intravenous fluid remaining in bag.
Okay. So after
Made the patient comfortable. Universal ending steps.
that, okay. Then back to a comfortable position. Call light and reach, bed in lowest position, policy if you need anything.